Good morning, everyone. I'm Brian Hammond. I'm the chairman of the board of Lee County Commissioners. I'm joined today by Commissioners Cecil Pendergrass and Ray Sandelli, also our Sheriff Carmine Marcino, the majority leader of the Florida House of Representatives, Dane Eagle. Representative Spencer Roach plans to join us today. Sanibel Mayor Kevin Ruane is here with us. Angela Smith, our county health administrator from the Florida Department of Health, is with us as well. And we're also joined by a team from the Department of Emergency Management, as well as our partners from the Minnesota Twins, to talk about an exciting announcement today. I want to say that today is not only the beginning of a new month, but today is the beginning of our recovery from the COVID-19 pandemic. Better days are ahead for all of us here in Lee County. As we begin to safely and deliberately get people back to work, we know that testing will be an important tool for all of us to monitor our progress. We're here today to announce the opening of a major testing site in Lee County. We are going to very quickly begin ramping up the testing for Lee County residents. The CenturyLink Sports Complex, where we're at today, will launch as a state of Florida drive-thru testing site. This site will be opening on Monday, May 4th. The site will operate from 9 a.m. to 5 p.m. all day long. The biggest thing that you should know about this site is no appointment, no prescription, and no doctor's order is needed. This will be one of the largest testing operations that we have in Lee County when it's up and running. Launching this testing site has truly been a team effort, and I do want to thank our partners at the Florida Department of Emergency Management. I want to thank our partners from the National Guard and from the Minnesota Twins who have helped us get this facility up and ready for this. I also want to thank the Lee County Sheriff's Office for the security that they'll be providing as well. Also on Monday, another drive-thru COVID-19 testing site will open. This one would be at a Walmart, and it would be a partnership between Walmart and Quest Diagnostics at the Super Center on Lee Boulevard in Lehigh Acres. Now that site will test anyone who exhibits symptoms of COVID-19, as well as all first responders and healthcare providers. The hours for the Lehigh Walmart site will be Monday through Friday, 7 a.m. to 10 a.m. That one will be by appointment only, and that appointment could be scheduled at this website. It's myquestcovidtest.com. That's myquestcovidtest.com. And we'll put that information on our website, leegov.com, for you to find. As the governor outlined in his plan for Florida's recovery, one of the ways that we can help our citizens return back to work in a smart, safe, and responsible way is to provide more testing like this. Ramping up our testing has helped us to achieve the goal of detecting any new cases so that we can get an accurate picture of how many of our citizens are infected. It'll also help us monitor our progress as we go back to work. At this time, I'd like to turn it over to Commissioner Pendergrass to say a few words. Commissioner?
Thank you. Thank you, Chairman. Thank you all for being here today. You know, it's a few months ago we were here at spring training, and here we are now with the testing facility. This is a perfect exhibit of what's going on in Lee County, us all working together as a team to make sure you as the citizens are going to feel safe. As we move through this process of this crisis, we're going to make sure we have testing available, so for your own safety and peace of mind, as we move forward with openings of businesses in Lee County, you make sure you and your neighbors are being treated. So this is another great example of us all working together and making sure we have the testing so you are conveniently be able to be tested. Like Commissioner Hammond said, no prescriptions required, so it'll be opening Monday. Again, thank you.
At this time, I'd like to ask Commissioner Ray Sandelli to share a few words.
Good morning, everybody. Just another beautiful day in Florida. We are truly blessed. All the decisions that we have made to this point have been based on the best information that we could gather, assimilate, and look at. And the decisions going forward will be based on the same thing. And this site is another important part in that process, collecting information that allows us to make decisions going forward, but also to protect our citizens. So thank you, take advantage of it, tell your friends about it, and let's keep moving forward. Thanks, have a great day and a great weekend.
Throughout this entire ordeal, one of our best partners has been our Lee County Sheriff Carmine Marcino. Sheriff Marcino and his deputies will provide security out here at the site. And I want to go ahead and give the sheriff a chance to outline not only the role of the sheriff's office at this testing facility, but also some advice on this weekend as we start to now enter the first weekend of May, where things are now open. The beaches are starting to open and the parks are starting to open. Sheriff?
Thank you, Commissioner.
Well, today's a great day, and I want to say first, thanks for being here. What a beautiful day it is. This is exciting for us because the Lee County Sheriff's Office will work cohesively with the National Guard and the Florida Department of Health to provide security and traffic control at this testing site location. One thing to remember, and I say this often, there's no I in team, but we have worked as a cohesive team from the very, very beginning. That's at every level. That's at our county manager, Roger DeJarlet, who's been a great, great leader, our county commissioners, majority leader. I mean, at every single level, your government has been working for you to ensure your safety as one cohesive team. And more importantly, I want to thank the residents of this county, because this has been very difficult for all of us and very unique. And without you, you're not being a part of this team. Without you, we would not be successful. So thank you for helping us help you and make sure that you're safe. As always, I want to request that the residents remain patient. Be kind to one another during these difficult times and follow the CDC guidelines. You know, as things start to open up, and we're all very excited, everybody can't wait for things to open up, we still want to make certain that we're doing it in a very, very safe and proactive manner. So let's make sure that we're still social distancing. Everybody wants to be on the beach, but when you're there, let's make certain that we're standing a distance away from each other and wash your hands and still move forward in a very, very safe way. As we are permitted these activities, I want to make sure that we have voluntary compliance and that we are following Governor DeSantis's recent executive order. I got to tell you, the governor has been a great partner. His office has been 24/7 for us. We're very blessed to have this team in place at every level. So thank you. We're looking forward to moving forward in a great way. Thanks for being here.
Sheriff, thank you very much. Again, for the latest updates on anything we've discussed today, please visit www.leegov.com/COVID-19. That's www.leegov.com/COVID-19. We'll put as much information about not only the testing site, but also business resources as we begin to look towards our recovery. You know, in closing, I want to leave you with this. More than 11,300 tests have already been done in Lee County. 91% of those tests have come back negative. To date, Lee County's rate of positive tests is 9%. And in recent days, we've seen testing results come in well under that. There is a light at the end of this tunnel. Please have hope. People will move at a pace that they feel comfortable at as we reemerge from our isolation. Some will be ready right now, and some won't be ready to come out for another couple weeks, and it's okay either way. I want all of us to remember to respect each other in our decisions as we make our own personal health care choices, and to be kind to each other as we get through this. God bless you all, and may God continue to bless the United States of America. With that, we'll take your questions.
Commissioner, what is the situation with respect to fees that may be required? How would they be paid? And also, logistically, how is this going to happen? Is this going to be pull up in a car and get a test? Is this going to be parked? And how are you going to control the number of people who are allowed in the facility?
Yeah, my understanding is this will be a drive-through site. The line will obviously queue up. We'll have it clearly marked out where the line should queue up. They will stop taking cars at 3 o'clock in order to make sure that they could get through everybody who's in the queue. But the hours of operation will be 9 a.m. to 5 p.m. My understanding is there is no charge for this, and I'm looking to Lee from our Emergency Operations Center. That's correct, right? So no charge for this. This will be something that you can show up without your doctor's order or prescription and get tested and screened right
But
here.
are people going to be tested while in their cars?
Yes, that's my understanding. People will be tested while in their cars.
Commissioner, who's paying for these tests? Is it something local or is it at the state level?
Yeah, there's a lot of resources actually that have been provided by both the federal government and the state of Florida to pay for these testing, these tests to be taken. This is an important part of our process moving forward to make sure that we understand a clear picture of how the community is progressing through this disease as we begin to get back to work.
when you get test results, is any of that data going to be shared, either as raw data or with the respective individual names of the state or local departments of health? What happens to the medical information once it's compiled?
Yeah, just like all of the testing that's been done to date, our Florida Department of Health has done a fantastic job of compiling all the results and then reporting them publicly the very next day on that dashboard that many of us are so familiar with watching now. They're going to take those results, and I imagine that they'll continue to do the contact tracing, which, by the way, the contact tracing that our local Department of Health has done has saved lives. I mean, they are really doing a great job of following up with the people who have tested positive, making sure that they notify other people who were around and in contact with those people that they should probably get tested and should probably take care of themselves. And I believe that by having that level of awareness, we really have saved lives and slowed the spread of the infection in Lee
Are you
County.
referring to the state or the local health department?
That's our, well, the
regional-
local health
yeah.
department is actually the state health department. It's our local Lee County office of the Florida Department of Health, yes.
Commissioner, how tests are available? Is there any concern that, everyday healthy people are going to come and get tests just in case?
So my understanding is that this site, once it's fully opened and fully ramped up, could handle as many as 400 a day. Now, a lot of this, though, is going to be dependent upon the demand. We're finding that there may not be a demand to do that many tests a day, and they're going to gauge it and scale their operations up or down depending on what they're seeing.
400 a day for how long about?
Well, we're going to keep this in place indefinitely right now. We have no end date that's been brought to us.
When somebody does test positive, if they test positive, if there are any out there, what kind of information is going to be sought by these public health agencies with respect to trying to track the progress of what they've got? If they test positive for it, are there interviews that will be conducted? Are there attempts to find out where the contact could have been made that led to a positive?
Correct. Contact tracing is happening here in Lee County.
And
Yes.
it's going to be part of this program as well?
Yes, that's my understanding.
Are we going to hire people to help with contact tracing?
That's a great question. I'm looking to our county health administrator. You've got a staff of how many?
I have 38 allocated to contact tracing at this time and requested an additional.
Okay, so 38 have been allocated to contact tracing at this time, and they're asking for even more. So yes, absolutely, we're going to keep working on that.
And then Fort Myers Beach just voted to reopen. What is your reaction to that?
So did they vote to reopen the beaches fully? I think that's a fantastic decision by them. As we get into the weekend, people really will need room to spread out on the beach, and so I applaud that decision to reopen the beach.
Commissioner, who's going to let people know about the test results? Is that going to be the Department of Health?
That's my understanding, that the Department of Health will follow up on the positive results. Okay. So basically, to say that into the microphone, yes, the National Guard and the Department of Health will coordinate on notifying people who test positive of their results, and they'll notify them as quickly as possible, and then they'll begin to work on, like they've done with other positive tests, the contact tracing process.
And then how long are these rapid tests? How long can we expect results?
My understanding is these are tests that are going to be processed through a commercial facility. There's no guaranteed turnaround time on that, but we have seen commercial facilities turn them around in as fast as 24 to 48 hours. Yep. Thank you guys so much for everything today and for helping us to get good information out. Have a great weekend.